We'll start preparing the radius with lidocaine, a back and forth motion for in excess of about 20 times. And we're using roughly about 0.3 cc's of 1% lidocaine. You can see the marking, which is just anterior to the tragus. We are also keep in mind where there is a mild depression at the just in front of the masseter muscle, and that usually is the location of the facial artery and facial vein, and also the location in which there is a branch of the marginal mandibular nerve that crosses over the facial vein. Straight line in front of the tragus. Sometimes this line needs to be placed a bit more posteriorly, and we can extend that to the mentum. Like to study injections to define the angle of the mandible. The depth of injection is below the skin in the deep subcutaneous tissue all the way down to the bone in this location. I'm closer to the masseter muscle. Now this is the area in which small injections have to be placed. The artery is fairly deep, so this is where it is wise to stay in the deep subcutaneous tissue, but I would be more cautious about going deeper than that. And the amount of injection has to be kept to about 0.05 cc's, so very minuscule amounts of boluses that are injected. Again, that's the area of depression, and it's imperative to massage fairly deeply to allow for disbursements. Palpation throughout where the bone is located, where some of the depression that may be not visible but palpable. Here we're starting to get the location of the angle of the mandible. In this patient, we are actually dropping the angle of the mandible more inferiorly for better contouring of the jawline. The posterior aspect of the angle of the mandible is a somewhat more safe area of injection. Once again, we're coming from a different direction. Our objective again is to define the angle of the mandible. And massaging to make sure we have a nice even contour. We're extending our injections to the chin. In the area of the chin, we like to go to the supraperiosteal level. It is important to define the projection of the chin by placing a vertical line from the vermilion inferiorly, and also using the oral commissure to the distance to the vermilion of the mid-lower lip as a guide. You can see that the injections are about 0.05 cc's and up to 0.1 cc in areas that we feel as to be safe to inject. But at no times do we increase our injections to more than 0.1 cc. To be able to transition from the gnathium laterally to the prejowl, it is important to keep in mind small aliquots of injections. Objective here is to project the chin anteriorly. At times we inject inferiorly as well to increase the height of the mentum. The injections are over the symphysis of the mandible. Here's a straight injection all the way down to the periostea. Palpation is important so that sometimes the swelling may want us to feel as though there is no asymmetry, but once we palpate, we realize there is actually asymmetry present. You can actually see the angle, the jawline, and it really lines up with what we had planned on before, and we can actually take a look and see there's a better definition of the angle of the mandible. It is important at this point to use the palpation and visualization to do any subtleties and improvements. So our injections were started by defining the location of the angle of mandible first, and then moving anteriorly. Palpation again is important to locate the mandibular notch, which is just anterior to the which is just anterior to the masseter muscle. Swelling is fairly common with the calcium hydroxyapatite, so persons are forewarned that swelling will usually last about 48 hours and may make the area of injections look a lot more prominent than it actually will be once things have settled down. At this point, the injections are kept in the deep subcutaneous tissue and to avoid the depth of the facial artery.